40,000 people waiting for long-term care today. We have 4,500 fewer long-term care spaces in our homes today.
We need a good understanding of the problem. We need to know what the various problem statements are in order to fix the system, to improve it.
Do not build an institution, build a home, and make sure you have a cluster program to accommodate others in the community.
From the Zoomerplex in historic Liberty Village, the Zoomer with Libby Znaimer.
Welcome to the Zoomer. I'm Libby Znaimer. COVID-19 exposed the fundamental weaknesses that led to the catastrophe in our long-term care homes. In the first three waves, nearly 16,000 nursing home residents died. They accounted for only 3% of cases, but nearly half of COVID-19 deaths. The problems have existed for decades, and governments keep pointing the finger at their predecessors. Lately, they have begun to make financial commitments to protect our most vulnerable, including investments in modernizing the infrastructure and in recruiting PSWs and nurses. But is it enough? Before we dive in, let's tee up the topic.
When the pandemic hit, by June, 4 in every 5 COVID deaths were in long-term care. Canada's proportion of deaths at the height of the pandemic was double that of other wealthy countries. While privately operated facilities tended to result in more deaths. But the experience varied by province, and despite COVID's disproportionate impact on nursing homes, there remains a backlog of almost 40,000 people in Ontario waiting for a bed. COVID has increased the desire to age at home, but long-term care facilities are still essential to meet the needs of an aging population.
Before we can fix long-term care, we need to know how big the problem is. And a recent report from the C.D. Howe Institute has a staggering estimate. It says that making the necessary changes would require nearly every new dollar of health spending to go to seniors' care. And that would come to 4.2% of GDP annually by 2040. Duncan, your conclusion is that that is not feasible, correct?
Well, if you look at the Commonwealth Fund's description of comparable universally available health systems, we in Canada are already near the top end of the proportion of our gross domestic product that we spend on health care. And in that basket of money that goes into the provision of health care generally, a very small proportion goes into long-term care relative to other developed countries, particularly European countries. Now, we're better off than the United States, and we are, of course, accustomed to consider ourselves against the United States. They're our near neighbors. But the data that the Commonwealth Fund displays reveals that we should be looking to the European communities as potential ways of doing a lot better to achieve better results, better outcomes measured in terms of health and well-being at lower cost. So to expand the amount of money we spend out of our gross domestic product to our estimate would in fact put us really at the top of the most expensive of the health systems in the developed world. That's not doable.
Charles, you're a former finance minister, 4.2% of GDP. It's a huge number. Can you hazard a guess?
Well, the GDP of the province of Ontario is now hovering close to $900 billion. Canada's is almost $2 trillion or thereabouts, so Ontario represents close to half. Estimates by the Financial Accountability Officer estimates that the increase and costs that are going to be required to support the necessary long-term care homes and supports for those most vulnerable will increase by an additional $5 billion. Right now it's around $4.2 billion that are spent in LTC in the long-term care component. It'll double as we go forward. And is that going to be enough? To Duncan's point, I've looked at many ways to foster savings in the system by being more efficient and then more effective in getting outcomes. And that was made possible to the tune of 4% of the budget without sacrificing those services that are most important to us. But we are not keeping up with the demands for long-term care, not just long-term care homes, just the notion of long-term care, be it by way of clusters, by way of home care, by way of actual institutional rooms for people. And that's why I put in the last budget additional homes, additional licenses for long-term care by 5,000 with the estimate of having an additional 30,000. But that costs money. But what's really expensive is PSWs, the professionals, the expertise, the means by which to provide the services that are necessary.
Donna Duncan, have you ever quantified the cost of getting to where we have to be, or at least getting to where some of the better European countries are at?
Well, it's a great question. And to Charles' point, we've got to reimagine what seniors care is, what long-term care is, especially as we look at our baby boomers. But quite honestly, we don't know what the quantum of the problem is. We know, to Charles' point, we have 40,000 people waiting for long-term care today. We have 4,500 fewer long-term care spaces in our homes today while we wait for new homes. And that's because we've reduced the number of people in a room to no more than 2. And we don't have a lot of time. The population over 80 will double in Ontario over the next 13 years. The front wave of the baby boomers are 75 today. And this really is a moment where it's not just about the money, it's about reimagining what care for our aging population is, reimagining what seniors care is. And the biggest arbiter of that, it's going to be our baby boomers who decide what they want from a living perspective as well as a care perspective. And it's not just about money.
From your perspective, Sam?
I'm not an economist, so I will defer to better financial minds than I, but I will agree very much with what Donna said, that we need a good understanding of the problem. We need to know what the various problem statements are in order to fix the system, to improve it. Because some parts of it aren't broken, but some parts of it are. And so what families want and deserve as Ontarians and folks who are our neighbors, friends, family, or parents, high quality long-term care where people are supported for their medical and physical needs, but their cultural, spiritual needs, to live with dignity and joy, for home staff, for PSWs, nurses, social workers to be paid well, compensated properly, and to have good work environments, so that they can care for people who have contributed to the beauty of this province and now require more care than their families can provide them at home.
Okay, we need to take a short break. We'll be right back with more of the Zoomer. Welcome back. I am delighted to welcome the iconic former mayor of Mississauga and now Chief Elder Officer of Rivera Incorporated, Hazel McCallion. Hazel, great to see you again, and happy belated 101st birthday.
Thank you. Thank you.
Now, studies find that after COVID, because of COVID, more than ever, people are determined to age in place and stay out of long-term care. What's your reaction to that?
Well, I think it's much better if you can stay in your own home. No question about it. Because when a virus gets into a facility, no matter how careful they are and how well it's managed, etc., it's pretty hard to control it. So if we can have a plan where people and can afford a plan to keep people in their homes all the time, that would be ideal. But ideal costs money. And is there enough money around to do it?
Hazel McCallion, thank you so much.
You're welcome.
The immediate need for investment in long-term care infrastructure is clear. The conditions in many facilities are deplorable. Older homes have 3- and 4-bed wards with shared washrooms and residents separated only by a curtain. Many are slated for redevelopment that cannot be accomplished on the land they now have. So what does it take to build or rebuild a facility? Charles, you are involved with this, and you were involved as the finance minister. So give us a sense of what it takes.
We know that, especially in the major cities where intensification is an issue and the properties are extremely expensive, very, very difficult to build for seniors and for affordable housing. So as I was leaving politics, I put in the budget 5,000 homes. I put also about 800 of them to be cultural specific licenses to accommodate the needs of certain communities that were neglected. And I volunteered, I put forward my own, together with a few others in the community, a long-term care home and a foundation for the Portuguese-speaking community. And what we found very quickly is how expensive it is to do and how many obstacles are there in putting one forward. So we now got the licenses, we've got the property right in downtown Toronto, it lands down on Bloor. Magellan Community Charities is the name of the home, which is a Portuguese navigator who circumnavigated the globe 500 years ago. And we're catering to the broad community as well. But it costs almost $100 million to build 256 beds plus 60 apartments for continuum of care and to support those most vulnerable. And also have a community space on the main level to accommodate other members of the community who are not residents, but who also need care and programming. But the issue is, how do you build one? It's very, and if you're a not-for-profit, if you're just a charity, you don't have the deep pockets. I'm relying on community to be philanthropic, and I need to raise $15 million just to start so that I can get a loan to build. And that's where we're at. We've got a lot of support.
So everything we hear is that these homes should be more like homes, less like institutions, and with the best of your intentions, 256 beds is still like an institution. Sam?
I think that we need to reimagine what long-term care could be like, to Donna's point, but also not get stuck in this big versus small. What is the in-between? How can we take advantage of the real constraints? Ontario has a mix of densely populated, like Toronto, land is at a premium, and places that are more rural that may have their own challenges. So what are the options in things such as having smaller neighborhoods, but within a larger build? So that way you kind of have the best of both worlds. So I don't think we need to choose one or the other. I think what we need to focus on, to Charles's point around how do you have a long-term care community that is connected to the larger community? Do you have space to bring in folks who don't necessarily live or care for those who are living in that congregate living environment? Do you have 1- and 2-person rooms that take advantage of the small space, but perhaps on multiple floors? So I think that this big versus small dichotomy, we really need to think about both and, not either or.
The gold standard for long-term care is generally represented by the country of Denmark, which passed a law to preclude the country from building any new nursing homes many years ago. And they haven't. In fact, they've closed some that pre-existed that law. They provide for community-based services, home and social and recreational and athletic, and a number of services that enable people to remain happily. And the happier you are, the healthier you will be in your own home for as long as possible. We do not do that. We're kind of fixated on institutional care that, in fact, is not what people want, particularly seniors.
Well, it's well known. And still, I don't have the number in front of me, but there are hundreds of people who go into nursing homes sooner than they have to because they can't get enough cheaper home care. And there are still more people stuck in hospitals because they can't get into long-term care. Donna, it seems like a circular thing.
Yeah, absolutely. And I think to Sam's point, we've got to look at things regionally. And I know to Duncan's point, I'm one of those family members whose father, we couldn't care for my father at home anymore. We kept him at home as long as we could and were able to avail ourselves of all of the resources, including through the Alzheimer's Society and volunteer services, but we couldn't. And so we know that there will always be a need for those who need more care. And the government is making a big shift now to bringing more of a palliative philosophy to long-term care. As I mentioned earlier, and it was mentioned earlier in your voiceover earlier, there are 40,000 people waiting for long-term care today. What are they waiting for? We know today, especially after the pandemic, the entry point into long-term care now is through hospitals. Almost none of our admissions are coming from community today. We are seeing admissions of people who are at end of life with highly complex medical needs that can't be met at home. In many cases, because their local community doesn't have the supports, the families don't have the supports, and we know that home care crashed over the last 2 years as well. To Sam's point, it's not an either or. We've got to really pivot very quickly to act on what do we need to build today and start to move on enhancing those home care and home and community care supports.
Okay, I just wanted to get back to one point, and you were lucky enough to get the land 3 years ago in the middle of Toronto. A lot of those homes that have to be redeveloped can't do it on their land. Land is through the roof. And Donna, doesn't it mean that people who are being served in their communities now are going to have to go who knows where?
Yeah, absolutely. And I know Charles has experienced this with the Magellan home that they're working to build in downtown Toronto in particular, but also in smaller communities around the province. There are different issues in northern and rural communities in terms of their ability to rebuild, but we are seeing real challenges. In downtown Toronto, I know just if I think about it, some of our members, about 8 homes in downtown Toronto representing thousands of spaces in long-term care will not be able to rebuild. And many of those are serving indigent populations, as one home supports a population with mental health and addictions disorders. Another one supports a Cantonese population. If we can't rebuild these homes, who's going to support these individuals? In many cases, they don't have family members to help them, and it is going to put enormous pressure on the municipal and community resources if we don't act now.
Okay, quick break. We'll be right back. Welcome back. Ontario will need 37,000 additional personal support workers and nurses and other health professionals to fulfill the promise of 4 hours of care per resident by 2025. Those estimates don't take into account attrition or the aging of the population. Donna, how are we doing recruiting those people?
Well, I would say, Libby, this is our biggest crisis, and this is a global crisis. It's just not about Ontario. It's not just about Canada. This is the biggest challenge that we're facing today. It's all well and good to make commitments about rebuilding spaces and building new spaces in long-term care, but our entire healthcare system is struggling to maintain the nurses and personal support workers and other professionals that we need. It takes 4 years to educate a nurse, 6 years for a nurse practitioner, 8 to 10 years for a medical specialist. We don't know what the scope and scale of the problem is and who we need to replace. The government's made commitments. We have 2,000 nurses being educated today, but we don't know how many nurses we've lost over the last 2 years across the entire health system. And we're hearing from our colleagues in home care that they're losing their nurses and PSWs to long-term care and to hospitals. We're losing to hospitals. I think this is going to be the catalyst for system reform, because we're going to have to think very differently about how we're caring for our aging population if we don't have the specialized health human resources that we need, and we don't have them.
The word is that we've lost 4,000 PSWs, and yet they don't have good working conditions. They don't have full-time work. They don't have benefits, and they have a very difficult and important job. How do you see that on the ground?
I hear from families regularly with concerns about homes being short-staffed, about using agency staff who don't really know the residents or know the families or know the home. I'm not saying there isn't a place for agency staff to pitch in, but when if you're running short on PSWs, you're running short on nurses, there's a real impact on the quality of the experience for residents who maybe want to take a little bit longer to get up in the morning. Not everyone's an early bird, or who need more assistance in daily living. And then never mind the impact on families who are trying to get information or convey information to staff about how to best care for and care with that resident. I'm not surprised we're losing PSWs and nurses when the conditions are that hard for them. They're Ontarians too. They're people, they're our community members, they're our families and neighbors and loved ones. And it's a hard job, and we're not doing a good job of caring for them so that they can provide the care that residents need and deserve.
I'm going to ask you a political question. Former Liberal finance minister, nurses are clamoring for a pay raise. PSWs, everyone acknowledges that they need a pay raise. How much of this is a problem of paying them properly, frankly?
As you may remember, we actually did increase pay for PSWs. We worked very closely with them, recognizing that they are underpaid for the tremendous amount of work they do. And in fact, when you're building a home, you're not just attracting residents, you're attracting teams and staff and people who will want to work there. And so when you ask the question, what do they want? You got to ask the question, what do staff want? And what do the people who work there want? What do the families want? And that's why we're going to be hiring well over 300 people to serve the needs of the community and this complex, which is a continuum of care, right? It's not just the long-term care component, it's also the 60 apartments of independent living and assisted living, and a half-acre park that's going to be mixed in to enable the community to also benefit from the complex that we're trying to put together. But we need to attract good people, and they don't exist. And of course, we're looking for people that speak different languages to service the needs of those elders who revert back to their first language. It's a challenge, and that's going to be our biggest obstacle.
Sam mentioned going through agencies, and another situation that I encountered when I needed a bit of home care, a lot of the money goes to middle people. And not to, and the people who are working on the front lines can't get a raise.
We're seeing a real shift in the workforce today, and as Sam noted, we're losing in our hospitals as well, are losing a lot of our nurses and our PSWs to agencies. Some of that is about compensation, some of that's about exhaustion and burnout. There's a lot more flexibility when you can pick your shifts and work when and where you want to work through an agency at a higher rate than if you're working in a long-term care home with benefits. We have to completely rethink our workforce and how we're going to build and support our workforce. We need to value our frontline staff. We need to support them with their mental health and well-being. Just as our residents and our family members have been traumatized over the last 2 years, so too have our staff. They're burnt out. They have post-traumatic stress disorder. We've got to find a way to lift them up. And we have to restore trust and confidence in long-term care for the benefit not only of our residents of today, our residents of tomorrow, for our family members who are on that wait list of those who are waiting for long-term care, but we're not going to attract the best and the brightest. We're not going to attract people to come in and support our aging population if we don't value them. Compensation is one piece of it, but as we saw at some of the worst points of the pandemic, with pandemic pay and wage enhancements for PSWs, that wasn't enough to bring people back. We need to change how we talk about long-term care and what it is. We need to value aging and value care for our seniors, and we need to value the people who do that.
Okay, we'll be right back with more of the Zoomer. Welcome back. In Canada, much of the criticism during the pandemic was directed at for-profit homes, which appeared to fare worse than municipal or not-for-profit homes. NDP leader Jagmeet Singh said that his party, if elected, would end for-profit long-term care. At the same time, the financial sector, including private equity firms and publicly traded companies, is expanding into this market. It's happening here and in the U.S., and U.S. President Joe Biden addressed the issue in his first State of the Union address.
And as Wall Street firms take over more nursing homes, quality in those homes has gone down, and costs have gone up. That ends on my watch.
Duncan, is there a role for government to step in and stop some of this buy-up, or, as in the case of Jagmeet Singh, to buy up all the for-profit homes?
If that is directed at me, I'm less concerned with who provides, who builds, and who operates the homes than I am with our seeming persistence with the existing model. We are facing a financial problem, as our panelists have pointed out, as the population ages and for a variety of other reasons. We need to look at the model of how we are providing care and figure out a new way of doing it that respects the desires of the people who are served, the aspirations of the people who do the serving, and the ability of the country and the individuals to pay for it. We seem to be doing our modeling about how many caregivers are required without considering the necessity of a new model so that long-term care applies not only to institutional care, but to care at home, care in your community. As one of our panelists has said earlier, that will vary depending on the circumstances. What happens in rural Ontario and what happens in urban Ontario have to be different. We need a model that fits the circumstances in both of those environments. And then we can get on with some sensible health human resource planning. Currently, nobody is doing health services support planning. There are 22 separate regulated health professions in Ontario, and one very important one, PSWs, not regulated. We need to turn our attention for in the so-called system to do some serious planning about the long-term future that and the number of different categories of caregivers who will be required to meet the needs of Ontario's and indeed of Canada's population. Now it's time to get at it.
Charles, you're building a not-for-profit home. Do you think it's feasible to talk about abolishing for-profit?
I think it's important for us to serve the needs of the community and serve the needs of those that are growing in demand. And the government on its own through a not-for-profit scenario will not be enough because the demand is so great. So we have to do both. And we have to do home care. We have to do a whole series of things. But in the city of Toronto, where people are living in high rises more and more, you're competing against very limited space. So we're building something that's rather unique and is being used now as a model to illustrate home care, to illustrate apartments and affordable housing, and to put long-term care in the same building to enable those that are going to need end-of-life services. Because the majority of them only, it's about 18 months to 2 years. Most people live in those long-term care homes. So you want to provide safe, you want to provide dignity. We're providing private homes, private rooms, and semi-private, so they're completely separate. And so it enables them to have a greater degree of safety and a good working environment to attract those that will want to be there, because that part is also critical for them. So in terms of abolishing private versus not-for-profit, I want to be a not-for-profit. I want to provide as much resources to serve the needs of those that are the residents, and to provide greater value to those that are working for us, because ultimately they're all part of this project.
Again, the critics say, how can people say it doesn't really matter? That's not the metric, whether it's for profit or not for profit. But the critics say, hey, if you have to pay your shareholders, how can you deliver the same level of care as an entity that doesn't?
I'm going to defer to the former Minister of Finance to explain how dividends work and how people borrow money. But for us, the number one priority, and this came out through the Commission, is people who are delivering long-term care have a duty of care to the people they serve. And in our view, we've got to think about the urgency of the situation in which we find ourselves today, 40,000 people waiting. What is the problem we need to solve? We need to solve the issue around quality. We need to improve the model of care, but also improve the models of living and balance that. And the Government of Ontario has proposed something that we believe and our members believe are going to be the biggest driver of quality, and that's a satisfaction survey, an experience survey for residents and families. We know that our residents and our family members and prospective residents and prospective family members want to know more about what was the experience of the people who are living there. How did they enjoy it? What was their living circumstance? What was the care environment? And in our belief, that's where the mission is really going to be driven. And it's going to be driven by the consumers. It's going to be driven by your audience and what they want and how they want it. Your audience has 172 different ways to order a coffee at Starbucks. I don't think the general public today and our aging population is going to take the care we're providing today, whether that's for-profit or nonprofit. I think we've got to find a way to serve the broader aging population that's only aging day by day rapidly, and we're going to have to do it in a really different way. And it's going to be up to us to hold our leaders accountable for that change, and we've got to drive the change and say no to the status quo. And whether you're a nonprofit owner and board or a for-profit owner and board, we've got to send the message to them that this is what we want and this is how we want it.
Okay, we are going to take a break and we'll be right back. Don't go away. Welcome back. Let's check in with our virtual audience for some of their questions, starting with a question via email from Ed, and he's directed it at Charles. The question is, would it be feasible for the provincial government to force some large home developers to include long-term care homes in future new communities they plan to build?
It's a good question. Right now, there's something called inclusionary housing, where we're trying to encourage developers to build affordable housing in some of those communities. The problem with long-term care, it's heavily regulated, and who's going to operate it? You're not going to ask a developer to assume that liability and that responsibility. You're going to have to put a whole group together to do that who will want to. Now, we're volunteers in my board. We're doing it out of love, and we want to give back to the community that has helped us and has opened doors for us, these seniors. But you can't force somebody to do the same thing, because there's a lot of liabilities, a lot of costs, there's a lot of engagement, because building it is one thing. Operating the home That's a different story. And that never ends, and that's always a challenge. So we need individuals and we need the government to support those associations and organizations that want to build and want to fulfill the needs, and also want to fulfill the broader perspective of long-term care, not just the institutional side, but the entire spectrum of providing the services that are necessary.
Okay. Next, we have a question from Doreen.
Hi, everyone. I live in a co-op, a seniors co-op, and as our aging members, we get a lot of PSWs. And so I'm wondering, when you think of a PSW, we automatically think of a female doing the job. What can be done to attract more men to do this job for the aging male population?
I think that's a great question, Doreen. Thank you. And we've certainly seen in our nursing complement far more men going into nursing, especially from diverse communities. We've got to make it. We've got to set examples, shine a light on those male leaders, and we have a lot of men in our long-term care homes who are actually doing this. And so we need to champion them, use them as the voices and the role models, work in partnership with our community colleges to really shine a light on their leadership and promote diversity. We have a lot of men in our seniors housing, in our seniors long-term care, and now's the time. I think that's a great opportunity for us.
Our next question is from Denise. Hi, Denise.
Hi, thank you. Yeah, I'm in British Columbia in Vancouver, and I just wonder, is there any data or any of this relevant to the other provinces?
Donna.
Yeah, absolutely. Certainly, as we look across Canada, we know that Quebec has a lot of work to do in terms of rebuilding their long-term care homes as well, and on staffing. They've had a number of inquiries. British Columbia has made a lot of progress on their capital redevelopment, and in fact, they're only moving to single rooms in terms of their buildings. New Brunswick, Nova Scotia, PEI, we're all working actually very closely together, and my colleagues in other provinces are meeting regularly on all of these issues. The number one issue we were all talking about, though, is our health human resources. And whether you're in Ontario, British Columbia, Alberta, or Prince Edward Island, we all have staffing issues. And as we think about building out our workforce in Ontario, we've got to be mindful that if we're going to be competitive and support each other, we've got a lot of work to do nationally, and we've called on our federal government to support us with a national workforce strategy.
When we come back, final thoughts from our panelists. That's next. Welcome back to theZoomer. It's now time for final thoughts from our panelists, starting with Duncan.
Well, my final thought is we should emulate the gold standard for long-term care that exists among other developed nations. And I refer particularly to Denmark and the Netherlands, who spend about the same amount of money, share of their gross domestic product as we do now, and they achieve greater happiness, wellness among their senior citizens. Let's take a close look at what they're doing and emulate it.
Sam.
Fixing long-term care is a big question, and we need to break it down into looking at what's working well and what's not. So ask families, ask staff, ask residents what it is that they want and need in order to live, work, and care in a thriving environment. Cultural competency of staff, emphasizing diversity, looking at really focusing on a good quality experience and life and living and joy, not just what's not working well, because we need to aspire to excellence, to aspire to what is working well and emulate that across the province, across the country, to the point made about what's happening in BC. There are things that work. We need to do more of that and aim for excellence.
Donna.
Well, this is the moment. Libby, thank you for the conversation. I think this is a discussion that all of us need to continue to have. We can't stop the discussion. I really invite each and every one of your viewers, everyone out there, adopt a home, go visit a long-term care home, speak to a senior, speak to your MPPs and your elected officials, and let's continue the discussion that starts with change today. We know the status quo is not going to work. We need to stabilize our health human resources and build anew. We need to build new homes. We need to stabilize the sector in the context of the entire health continuum, including housing for our aging population. So let's mobilize. This is a moment of disruption. Let's organize, mobilize, and change. We can do this, and if we rely on our public decision makers, it's not going to happen, and it's got to be different. So let's act today.
Charles.
Yeah, COVID brought to light so many problems that have existed in the long-term care and in the healthcare system. And all governments, successive and previous, mine included, we all needed to do more. And the problem is, they can't catch up. Even now, it's going to be difficult. I had PSWs calling me after I had lost my election, and they were suffering through COVID, and they were afraid to go in certain homes, warning me that these homes were not effective and were in desperate need of repair, and asking me still to correspond with government officials to provide support. Andrew Picard, Neglected No More, wrote a great book about some of these situations. I encourage you to read and look into that and provide some of the supports that he suggests that we do to fix long-term care. But it requires all of us to do our part.
Thank you so much to our panel. We have not fully answered the question of how big the problem is, but I think the CD Howe report nailed it with the conclusion that fixing long-term care will require a radical shift away from the institutionalization of the elderly. And that's what people want. The question is, will our governments have the fortitude to make it happen? Thank you for being with us. We'll see you soon. It's time to zoom out.